also the adolescent, so chapters 34, 35. Exam 1 is next week during class time. There are reviews tomorrow. I do the first one at 5:30. The second one is Professor Morris on Wednesday at 5:30. And the third one is on Friday at 5:30 by Professor Okorafor. You will be getting recordings to every single one. Has anybody tried to go to Professor Bogart's Pediatric Nursing YouTube channel? Everything is there. And it's going to be every class, date, and time. So you are M6 to 8. So that's Monday 6 to 8. You're going to see your recording for you. So it will be posted. And know that in the information area, I will put the Kahoots there also. I will, of course, still post it in announcements with the YouTube link, and I also will put also the Kahoots for you so that you can go in and look at them also, because you know they are important. There's really good concepts in them that will help you through the exam, help you through HESI, and help you through NCLEX to become the amazing nurses that I know all of you will be. Okay. So I will check on the Burns case study, and I'll send in a help ticket, and I will inform you what's happening with that, okay? So let's start with our PowerPoint. Doesn't want me to connect you yet, does it? Okay. So week 3, we're going to be talking about the last 2 groups of children. We've done infants, toddlers, preschoolers. Now it's school age and it's adolescents, and all of them have their own, you know, things that are specific to their age groups. So we know school age children is ages 6 to 12. It's a big thing. 6-year-olds are sort of still a child, and the 12-year-olds are trying to be grown up. So it is a big, broad area. It starts with baby teeth, and by the end, the permanent teeth are coming in. And we know the end starts, we know the end is there when puberty begins. And that is a description of when the time frame of the school age children. So the baby teeth go out, the deciduous teeth are there, and then the puberty starts. This is a time of growth that's very slow, and it's not very rapid, but it is also always going. Little weight, a little bit of height. The one thing that's a concern is there are some young children that look very mature, just their facial expressions. Remember, they might be 10, 11 years old, but still their emotional and social maturity is not where it needs to be. So again, like we treat the 3 or 4-year-old by saying, starting information with, you know, oh, you're this cute little Batman shirt, or, you know, you got cute curly hair or blue eyes. We're going to still focus and give that beginning on their level, not what they look like. They're 11. We will talk to them like an 11-year-old. So 2 inches a year, they gain 1 to 2 feet in those 6 years. Weight almost doubles in those 6 years also. But by the end, boys and girls will stay the same. You know, we know by the time they become adolescents, the boys are taller and the girls are shorter, but not now. So we are more graceful. We're not as awkward and uncoordinated. We know that baby fat goes away. There's more muscle. The head circumference, we know, has nothing to do with the chest anymore. And our face becomes slimmed out and becomes more mature. And this is that age of all I want for Christmas is my 2 front teeth, because their teeth are falling out. And I think it's so cute to have a young child smile and those front teeth are missing. Their bladder capacity is increasing. Their heart is not this big thing in the chest anymore, smaller. They have had many viral and infections, so their immune system is really strong. They've had all their immunizations, so they can fight disease really well. Their bones are more ossified. We know the younger children, they're softer and it's easier to heal. As they get older, it takes longer for those bones to heal. And we know, just like I said, physical maturity is not correlated with the way that their emotion or their social maturity is. That means what they look like is not the way that they think. So always remember, these are still children. Prepubescence is a period of about 2 years before 13. We know girls usually start puberty about age 10 and boys don't till 12 years old. So there's 2 years difference there. This is the age where girls go, those boys are dumb, they're silly, they're stupid, because they're not maturing at the same rate as girls. Girls mature earlier. Now, as we assess these children, remember the age. 6 years old, you're going to talk differently than you would talk to a child who is 12. So you're going to always explain on their developmental level, no matter what they look like on the outside. We're going to use those simple terms. And if you've ever seen an x-ray, there's this big machine. They click, 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 and try to push it at you. And a 6-year-old will run in the opposite direction. But if you say, it's just a big camera, and it's going to look inside your body, and we're going to be able to see it. And when it's done, I'm going to show it to you. So you can see what that broken bone looks like, or what your heart looks like, or your lungs. And then you make it fun for those younger children. They're going to be more easily, you're going to do it a lot easier without this screaming kid running down the hall in the opposite direction. When you look at the abdomen, you're going to first look. That's the inspection. We're going to do auscultate, we're going to percuss, and we're going to palpate it to see what's going on with that abdomen. Remember the lymph nodes in the neck. If you don't feel them, the kid's healthy. There's no infection. If you feel lymph nodes, it's going to be there's something wrong with the child. The child doesn't feel well. The child's sick. So lymph node, you shouldn't feel them at all. When you're doing your assessment and you're doing the cranial nerves to assess the hypoglossal nerve on a child, all you have to do is stick their tongue out. And I know that even the young infants, if you look at them, they like to mimic what you're doing, and they'll stick their tongues out too. So it's actually very easy to do. One of the things about children is that they have this upper airway noise when you listen to their chest. So to listen to the breath sounds properly, knowing that there's all this upper airway mucus, and if you want those bronchial sounds, you put your stethoscope over the trachea, because that's just showing you those upper airway noises. If you can instruct a child to cough, usually they'll disappear, like rhonchi, they will disappear. Now, if you want to listen to breath sounds, you're going to have to go over each lobe of the lung, and then you could listen to it easier. Now, Freud's all about oral and sex, okay? Whenever he talks about anything, we know the young infant sucking, chewing, licking, all is satisfaction. That's the exploration of the world around them. As they get older, what it is that the school-age child wants same-sex peers. That means girls, their best friends are girls, and boys, their best friends are boys. And they really, really need those same-sex peers. It starts really early, at 6 years old, they're still looking for my best friend. My Christian, who's just 5, who was right before that school age, if I hear anything more about Santiago, I mean, it's his best friend. And they look at each other for that, strokes of being needed and wanted and feeling a part of. Erickson talks about the sense of industry. Well, in the Erickson, industry versus when they can't do anything, which is inferiority, okay? Industry is when they can do a task, as in this child can play the piano, this child can kick a ball far, can really write the alphabet, the cursive, the best. He's good at math, spelling. That's what an industry is, what they can do and do well. And why do they want to do that? Because they want the praise. They want peers to approve them. They want parents to praise them, saying, wow, you've done really, really good stuff. Now, The other part is there's this intense thing to be able to do something. And then there's this intense of, I can't do it as good as such and such. So it's a feeling of inferiority. They want to do everything the best they can. So they can't, and that makes them not feel good. But what they can do, they try to focus on that, but knowing that they can't do everything all perfect. There are children that are good at spelling, but in sports, they're not good at all. But that's all children, and that's the way children are. Piaget is talking about understanding relationships between things and ideas. They can take things and make them work. They can take events that they want to go and be able to get there. Now, they're into this, what we call conceptual thinking, as in, if I do my homework, then I know mommy's going to be able to take me to the movies, because that's what she said. So I know what I have to do to get there. Another thing is that concept of conservation. Now, I talk about the concept of conservation and I use my children as an example when they were growing up. Usually parents go out for the week and shop for groceries on Friday or Saturday. And they usually will get a snack of some sort for the children for after school care. Well, I used to get Little Debbie's cakes. And they know there's a certain amount. There's 2 children, there's 10 cakes, so they can have one after each school day. And if they have 2 one day, they're not going to get one for the end. So that's how they conserve and make sure that they have them till the end of it. Another way to describe it is, they know there's a certain amount of uniforms they have. And some of the older school age children have to do their own laundry. So they know that if there's uniforms they have to wear, they'll conserve them to make sure that it lasts for the week. So that's conservation. Moral development, Kohlberg. Remember, Kohlberg's all about right and wrong and consequences. Doesn't matter the stage of it, okay? But these children might do something wrong if the benefits in their mind outweigh the consequence. The younger children just know, if I do right, I'm going to get something good. If I do something bad, a consequence will happen. Children that are school age tend to say, well, I know I shouldn't do that, but I really want to do it. So it's okay if they punish me because I want to do it anyway. So that's what Kohlberg says. There's spiritual
Can you
development.
go back for 1 second?
Which one? This one?
The Kohlberg one?
Kohlberg, right here, right and wrong. All about right and wrong. And right and wrong means he believes that there is an action that they could be right. They could do things that are right because they know they're going to get the reward for being right. They also know that you can be wrong, do something wrong that's bad. You shouldn't do it. But unlike the younger children who just know it that far, school age children say, well, I know I'm going to get punished or a consequence for that bad thing, but I'm going to do it anyway. That's the difference. Okay, Ariel? Okay. Spiritual development. Children believe in whatever their parents have told them, because this is from the house. This is the family. But the thing about God and children at this age, they believe if they've done something wrong, like I hit my brother yesterday hard and he got a bruise. Today, my tummy hurts and now my appendix is busted and I need surgery. It's because God is punishing me because I did something wrong. Now I'm being punished. So as a nurse, what does that mean to you? And I've done this many times. You get that young child into the emergency room, has an appendix that needs surgery. This child truly believes it's because they hit their sister or their brother yesterday, and that's causing them to have this to hurt and that they need surgery, which they could feel that now God's really going to hurt them and they're going to bleed to death. Remember Band-Aids and bleeding to death? This is still part of them. So I sit down and say, listen, you didn't do anything wrong to make your appendix burst. Nothing's going to happen to you. Yes, sometimes you do wrong things, but this isn't because of this. This is just this little piece of tissue you don't need. So let's just get rid of it. And it does actually make that child relax because they're not going into surgery thinking, I did something bad now. Now God's going to kill me. And they do think to that level. Peers are so important. Same-sex peers. They want to please their peers. They are really influenced by them. Now, remember, you've got a child who's raised by a family who only knows family values. Now you're getting into a situation where there's another person, and of course, their family values are influencing them. So now they're seeing a different aspect of life. And they do try to please them. Clubs and peer groups are so important. And this is starting being able to work together with other people and working together to do a common goal, whether it's a sport, whether it is a club, they're working together. But with any group, sports or with clubs, there's going to be someone who thinks they're Miss Know-it-all, Mr. Smarty Pants, and they're going to bully. So that's one thing parents need to watch out for. Families are still very important. They need to be there to guide them, to still have the rules for them. The parent needs to be a parent, not a friend now. They really need to help and guide them for making good decisions and talking with the children, giving them the independence as they are earning that to understand it, because this is getting a child ready to eventually go to college, move out of the house, and then have their own families. Play, again, children, play is so important. Well, at school age level, what is it telling them? Well, there are rules and there are rituals that must be done in order to play a game. This is how you win the game. They're teaching your child how to get, maybe in the future, go to college. What do they need to do to get their degrees? Because this is the rules, the things you need to do. This is teaching them how to, in a work environment, work with people, that this is your job. This is what you do. This is what you are going to result from that. That keeps your job, which is because you understood the rules, which started as a school age child. Team play, working together, doing things together, cooperation between children, very important. And then, of course, those quiet games together, learning things themselves is also important because it gets the mind, makes them think, and it gets them to understand themselves. And it makes them feel good if they can read good, or if they can write good, or if they can play pianos good or cook a meal good. Doesn't matter. Play is very important. So self-concept, children don't really know who they are coming into school age, but as they get out and are breaking away from the family, which is really hard for parents sometimes because now they've got best friends and then they go to best friends' houses and there's more adults that are sitting there just trying to, be a part of their family. They start being aware of what do they do good. They're starting to think about how they look. And they also are listening to other adults and other opinions. So their minds are opening to understanding, the world around them a lot more. Also, when this child is given this positive praise, it makes them feel good, makes them confident, gets them happy. And that's part of developing their self-concept. They really start to understand their body and what do they look like. Is they wearing glasses and nobody else is? Is their hair long? Is it short? Do they want to put in a ponytail with a big bow because that's what other kids are doing? Or is it, cutting it buzz cuts for the boys, whatever? They're starting to know hair and eye color has always been the most important. the kid with the most beautiful blue eyes or the big eyes. People, especially adults, are always saying, oh, your eyes are just gorgeous. So they're developing that body image. They are seeing that other children, other people are different. And there are differences. Wearing glasses, wearing braces, wearing hearing aids, all of these things are different, and they start being aware of those things. Now, when a child starts school, this is the first time where they're going away from the family into an environment where they have to follow rules. They have to listen to another adult, not parents or grandparents, doesn't matter. It's out of their house now into a different environment. It is where children start socializing with other peers, and they start seeing other values of other families. And at this point, these children need another, like, best friend Santiago, because you feel important, and actually sort of like a protection, because you can talk to other kid about what's going on. Getting into school, one of the things that as parents should be done is taking these children and reading to them, and making them feel important about who they are, and following rules, and getting them ready to go into school, and following a teacher who is not somebody they know. Nutrition is always going to be important. It doesn't matter. Nutrition, they need to eat well. I know that it's very difficult with many families, especially single parents. Even if you have two parents, I mean, you have to work today to make ends meet. So many times it's that fast food that comes into the house for dinner tonight because you didn't have time to cook, or you're too tired, etc. And that can lead to obesity if it's the wrong foods a lot, or most every day. Now, they're teaching school age children a lot of different programs, whether it's Dare to keep kids off drugs. They're also showing this internet site, which is called My Plate. And My Plate talks about nutrition in all the food groups. And children can play with the site and say, this is what I've eaten. And is that going to be a good food? Am I eating all of the right things like I should be eating? Now, what are things that can lead to obesity? Now, we know that, years ago, did we have as many obese children? Probably not. And one of the reasons could be is that today, children, they have a lot of technology that keeps them from going out and running around and playing. And that could be because of their computers, iPhones, video games, iPads, and they're more interested in playing the games and getting up and moving around. So they're eating and sitting, and that can lead to obesity. So that can, have them gain weight. Another thing is some neighborhoods, they can't get up and get out, and that's just the reality of life. Now, if you are an overweight child, there is a big risk that they're going to go through these, what we call cardiometabolic changes. And what does that mean? That means that, all right, so you're overweight, which leads to hypertension, diabetes, hypercholesterolemia, and this all is caused because they were a child who was, overweight. So we want to try to prevent that.
Professor Rogart,
Yes.
so what age group would you consider this being? Because I'm asking because I have a niece that's, in my opinion, is a little overweight, but they don't seem to want to change things up for her.
Mm-hmm.
And I see her struggle sometimes with breathing, and she's only, I think, 10 or 11.
So this would be a child that you would put in like an after school activity, or an activity like, they have all of these like bowling or swimming, or, girls have a lot of sports that are out there too that they could do to get them active. And, schools now are doing these programs, teaching them all about things like being overweight and nutrition, and that My Plate program is a great program for kids, and they love to try to fill in the blanks, but it comes from the parents down. So, and we know that today school lunches are getting a lot better than they've ever been before, because they were loaded with carbohydrates and high fat and didn't have other nutritional foods that they could eat. So it's a hard thing. Is it or is it not, obesity at that point? So we know preventative strategies to prevent obesity should start in pregnancy, through infancy, all through childhood. It just should be. That's why we know that an infant should double its weight by 6 months. We don't need to triple by 6 months. So if we're starting to see those things, this child could be that one that ends up obese later in life because we're not watching it. And that's one of the reasons why we do. All ethnic groups are a part of it. It doesn't matter ethnicity. It's all of them. Everybody has the ability to be obese. So target the whole population, not just some of them. We know that lifestyle interventions do show success preventing obesity, which could be like you, Heidi, encouraging some sort of program for her to move, whatever she likes to do, something to get her moving a little bit more. Another thing we see is school-age children are made to sit at the table and finish their plate until they can get up and leave. And it should not be done. It shouldn't be done. Now, there are children who want to eat a little bit and eat snacks later. Well, no, I'm saying if they have come to the dinner table hungry, ready to eat dinner, and they're not finishing their food, they should not be forced to finish the rest of it, because then they will, through their life, say, well, I have to finish my plate, and that leads to obesity. That's what that means. School-age children should sleep about 9 to 11 hours a day. We know the younger kids don't want to go because, I need another glass of milk, another hug, give me a kiss, I got to go to the bathroom. I mean, that's just part of being the younger kid. But as they get older in school age, they're like, I'm going to bed, Mom, give them a kiss and goodbye. But that's just what kids do. Now, sports are great. They're wonderful, but remember, there's concerns about that too. Number one, making sure that they have proper equipment to do sports and have parents involved, because there are some bullying things that go on in competitive sports. You have parents yelling at kids because they missed the ball or they didn't kick it or didn't do something. And then that child feels horrible. And sports are there for a child to get up and to move, and not for a child to feel bad, but to make them feel good for those things that they can do. We know children love to win. They love competition for sure. Dental health, we know we've started with baby teeth, and now we're going to those adult teeth. And we know that we need to do good care because this is what they get for life. You don't change them. These are the permanent ones. So flossing well, brushing twice a day, important. And then we know these children, some of them get these crooked teeth. So then they need braces. It's just part of it. And some things that children do is, and I've seen it a lot of times, where they're in the pool and they hit their teeth in the front tooth, the whole thing comes out. I've seen it in the gym at the park, falling down on the teeter-totter, and I see the tooth come out. Now, if a whole tooth comes out with the root attached and it's a permanent tooth, they can put that back in the mouth up into the gum. So how do we do that? If a tooth comes out with the whole root attached, and you'll be able to tell, you should place it in cold milk and get to a pediatric dentist or a pediatric emergency room, which has a pediatric dentist. And what they do is they put numbing cream there, and the dentist pushes it back in there. And many, many times it adheres there. Of course, the child will be on a soft diet for several days, but the kids do really well with it. So that's what we do if a tooth falls out. Sex, they're so curious. We know children play house and they check each other's things and whatnot. It's normal. It's normal for children to do that. They are in that process of exploration. So as parents, they do, and as educators, school nurses, we need to teach children things that keep them safe. I mean, it'd be nice if every parent could talk to children about sex. I mean, my parents, no, they didn't talk. My mother, we didn't talk at all. I mean, when I had my period, I went up, I said, Mom, I'm menstruating. She went, showed me a box, gave it to me with the pads, and that was the end of that. So, I mean, having a school nurse, or, someone in the medical community with good communication skills, it'd be a great thing. So these children are guided in the right direction. They shouldn't be guided by their peers or older brothers and sisters. Sex is normal, absolutely normal. The masturbation continues. This is just part of what they do. If they have a question, answer it. And again, it should be with the parents, but remember, they're school nurses, and those nurses in a pediatrician's office or at an urgent care emergency room, or in a hospital, these all are really important. School health has unbelievably changed a lot since COVID. School nurse would be just going and doing health appraisals, educating. If somebody got meningitis, make sure parents know, and you get the letter in the mail. And all of a sudden COVID came, and they become that person between school administration and the CDC and what community regulations were, and making sure that they followed it. So school health is a really important job. In fact, many nurses get into school health because they want to be on the same program as their children are. Will be off for Christmas holiday and off for those holidays that your children are. Injury prevention, again, motor vehicles is number one. That's always a number one when it talks to be injuries. You should have your child in a rear seat till they're 13 years old. I never did it, but that is the recommendation today. They should be in booster seats till they're 8. They should wear protective equipment like bike helmets if they're out there with their bike. One of the big injury things is the trampoline, and it's something I would never give my kids because I was afraid that they would hurt themselves. So trampolines are not good. Let's see. School age children, some disorders that they have that we see is ADHD, which is attention deficit hyperactivity disorder. This is the child who starts something and goes somewhere else and never finishes the task. This is hyperactivity, and they just go one thing to one thing. And many of these children really interrupt the whole classroom because they can't sit still. Now, these children many a time are sent to the school nurse, and maybe some of you will become a school nurse. So how do we work with that parent? Well, don't assume the parent's not doing anything. The parent could have taken away every privilege the child ever had, and the kid is still hyperactive, not doing what it's supposed to do, not listening to the teacher. It's just, part of what happens. So our job, if I was that school nurse, number one, sit and listen and let the parent tell the story about the child. Once you hear everything they've tried and done, then make a plan of care. So a child has an avulsed, knocked out tooth. The parents are reluctant to try to re-implant that tooth. Where should the tooth be placed for transport?
A.
Yep, it should be in cold milk. Absolutely. Now, why is it cold milk? I've been asked that before. I think it has something to do with hypotonic solution. Maybe it's the calcium in it. I don't know, but it preserves it and preserves the root. So adolescents, these are probably the most difficult age group of children. These children are starting being a child when they enter adolescence at age 13, and they become an adult in the end by age 20. They are starting with still needing a lot of care from parents to the point where then now they can go out and be on their own. They can work, go to college, have their own places. So this is a lot of flux. It is a lot of maturation that is required to be able to take care of themselves. Now, at the beginning of adolescence, they go through a lot of sexual change characteristics. Now, primary is what you need to have a baby, boys or girls. Secondary is how your body changes. Now, if you are a girl, the first pubescent change is you get little breast buds. That's the first thing. If you're a boy, you'll see testicular enlargement. And there is a sequence of events that do occur. So it starts with something and keeps going. This is Tanner's stage, and it talks about breast buds to big breasts. Then it goes from no pubic hair to a lot of pubic hair. Then we have the small testicles, and it goes to the larger testicles and the hair. And this is just part of that maturation. Now, this is one of the reasons why adolescents need a lot of sleep. They grow 20 to 25% of their total height within 2 to 3 years. That's a lot of growth. So infants, they grow a lot, right? What do they need? They need sleep and nutrition. What do adolescents do? They don't sleep because they're busy with social activities. They're not eating because body image, that's so important to them, and they don't want to be fat, so they not eating, have a nutrition bar and a bottle of water, and they leave the house for the day, and that's all they have. And because of that, now, are they getting proper nutrition with all of this height that's going on, all this growth? No. They say that there is some correlation between getting an early menses with obesity in girls, but has nothing to do with boys. Now, if you look at girls and boys, we know boys have a squeaky little voice, and then one day you get on the phone and the voice drops way down here. And you're like, when did he grow up? I know I've had friends out of state, so I could hear it better than actually the parent. I'm going, his voice just dropped 3 octaves. Wow, he's a man now. And, of course, his friends, we laugh. But it happens with girls too. You might have been a high soprano in the choir, and now you're an alto because your voice also changes. Erickson is a sense of identity. Who am I? Who am I? It could be your sexual identity. Do I like girls? Do I like boys? Do I like both? Am I a girl? Am I a boy? All of this stuff is going on. And where do I want to be? And what group do I want to fit in? Am I a band nerd? Am I a sports person? Am I into arts? Am I into music? Finding your spot in life. This is so important for the adolescent. So they're really going nuts, crazy, trying to find, where do I fit in life? Where do I feel good? Social development is, I want to be accepted by my peers. Once I choose my group, I want to be accepted because that's what's important. Peer acceptance is so important. Their identity is not what parents want them to be, it's what they want them to be most of the time. At this time, these adolescents like to be up and out of the house and go to the movies and the mall and someone's house and parties, and because they love that sociability. But what if your best friend is now talking to the guy that you liked and you saw them hugging in the hallway? Now you've lost a best friend and you've lost the guy you like. That's the intense loneliness until you find out, where do you want to be? So intense sociability, and then that loneliness. And this causes a depression. Children that are adolescents, there is a higher risk of suicide because of this loneliness. So it should be looked at. So the relationship with parents goes from parents being protective, now it's sort of mutual affection, trying to let a child do what they can, but also not letting them go crazy, like overdoing it. It is a time of turmoil and ambiguity. They want to be able to do everything. Teenagers think they're old enough to be able, I'm doing okay at school. I did my chores. I want to go out and la 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 till 4 o'clock in the morning. And the parent says, I don't think so. So it's parents still are part of their life, but they're not as the children has to realize that there's still some control on them and they don't like it. About the ages of 15 to 17, major conflicts over independence and controls between what's their responsibility and what can they do. They want to, of course, always do more than they're allowed to do, but what do I have to do to get there? And adolescents are smart. They really try to push it by saying, I've done everything I'm supposed to, I should be able to. But again, of course, there's a little limit there. Now, at this age, 15 to 17, it's suggested that parents and children sit down and make a list of what they need to do and what's the limits. You can stay out till 1 o'clock on weekends, not 4 o'clock. You need to be good at school, do your chores, blah, 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 and then you can go out. So it is this limits between them that they both understand. The relationships with peers are so important. It makes them feel a feeling of belonging, strength, and power. It gives them some dependence and somebody who thinks like they do, so they feel good. Best friends are usually same sex. And the thing about best friends in an adolescent role is how you treat your best friend is how usually you will treat your partner in life. So if you're not nice to your best friend, probably your relationship later in life is not going to be that cool. So nurses, getting with these adolescents, their very mindset, they know what they want to do. They don't want to listen to anybody, which is part of what adolescents do, is how as a nurse are you going to build up a rapport with them? Well, one of the ways to do it is sit with them, just like you do the young kid. Oh, it's a cute little shirt, the Batman shirt. Oh, you got cute little blue eyes. Well, how you doing at school? That's the young kids. Well, adolescents, I heard you're listening to some music. What do you like? So, what are you going to do after school? You're going to go to college? Or did you see that new movie? Or some questions which start breaking that ice. So now that adolescent doesn't feel so guarded, those walls come down and you were able to talk. Remember, you do not have to have a parent in a room with you, with the adolescent, when you talk about things like sex. You can ask the parents to leave. You do not have to tell the parents what they said unless their behaviors are causing them to harm themselves or others, okay? And that gives you that little autonomy to teach. And remember, as we teach anything, if they want to know about sex and contraception, etc., it's not putting in what your feelings are, what they should do. It's only facts, and you should give it an oral and written form so that they can go back and look at it. And that's what should be done. Another thing is, today's age, we have girls wanting to be boys and boys wanting to be girls, and that's all okay. Now, as a nurse, how do you address that child, that adolescent? Ask the child, because how do you want me to call you? For instance, very real life, I have a stepdaughter. Her name is Rachel, but she wants to be called Ray. She's having these feelings of more of the masculine side. Well, that's fine. Okay, I'm going to call you Ray. What did that just do for that child? That child now feels like you're listening, you're understanding, and they're more willing to open up to you. Remember, school nurse is always a great source for these children if they have any questions, on a daily basis. HPV vaccines are given at age 12 for girls. It also could be given to boys. Nutrition. Remember, they're not eating well. So make sure that they, if we're having problems, let's say with obesity, that we do a 24-hour diary of foods. Some children have 2 snack bars a day and 2 bottles of water, come home and have dinner, and that's it. All because, remember, it's that, body image. They want to look good. Sleep and rest, they should sleep a lot, but we know that they are out being social, and we know that they're working to get good grades in school, many of them, so they go to the good college. They should be up, out, exercising, moving around. Not all of them do. And again, dental health, doesn't matter what age child. Sexuality, how do they learn about it? Well, we know the TV today is unbelievable. I was telling the earlier class today that, when Lucille Ball, which is one of the first big TV shows that's you probably even understand who I'm talking about, they had a TV show where they showed the bedroom, and they showed the bedroom of a married couple, and they showed it with 2 single beds. And that was the talk, like, how do they do that? That they shouldn't be showing that. Well, today you see them doing whatever in bed, and so it is an influence. Now, we know that parents should talk to their children. My parents never did, so where else could I go? School nurses and Planned Parenthood, and that's exactly what I did. So school nurses are a great avenue for them to get sources. Motor vehicles are the big injury again. Adolescents, they got driver's licenses now. So, it is a problem that they can have accidents. We know there's all sorts of motorcycles, ATVs, all things that get on. Again, that's more injuries. They're being more of explorers, looking at dad's guns or the neighbor's, the peers, friend gun, and things go off, and accidents can happen. They are training harder. They're causing injuries because of overtraining, overuse of their muscles, etc. I mean, we need to teach them to have the proper equipment so they don't get injuries, so we can prevent them. So Matt is 14. He seems eating all the time. Although his weight is appropriate for his height, the best explanation for this is what? Anybody?
Is it A?
Okay.
Remember, they're growing like crazy. This is that age where that 20-25% of growth is going on. They need it because they're growing, very quickly. Good. So now we know about school age and adolescent kids, sort of. Maybe. Who wants to win Kahoots today? Okay, Jennifer does. So Jennifer will win. Mercedes, you don't want to win? She smiles.
I don't really.
Okay, Michelle, Albert, there you go. It's your turn. All right, let's go for Kahoots. We'll be out a couple minutes early today. I usually try to get out about 1/4 till. I try to make these things right where you need to have them so that we do. If I run over right to 8 o'clock, it's usually going to be unusual from now on, except for next week. Next week, we do have class after the exam, so be prepared. And it will only be a Kahoots, not a PowerPoint, so that you will get the information you do need, okay? And usually I run right to 8 o'clock.
It's making me log in or create an account.
You should be able to Kahoot it. No?
I think you just click play when you get on there.
You want me to wait for you, Heidi?
I got it now. Hold on.
Awesome sauce. Were you all able to go on to my YouTube site, Professor Bogart Pediatric Nursing? It has
Yes.
all the videos. The Kahoots are in the information bar, and you will see your class there also. I don't remember if I told you or my earlier class. I had a class from 3 to 5 today too, so I don't remember who I told what. Here we go. Let's get her done. It's late. You guys are tired. How does the onset of pubertal growth spurt compare in girls and boys? Is there a difference? So remember, girls usually start about 10 and boys start at 12. So 2 years difference. Good. And I already went up top first, and Lamika. At what age should a parent expect to have major conflicts over independence and control with their child? And this is where they should make that contract of what they need to do and what they're allowed to do and agree with it. I know adolescence was the hardest age for me to handle my children. And this is age 15 to 17. Good job. They turned out okay, so I did all right. The onset of puberty in boys is characterized by what? What happened first? So the first thing that happens, testicular enlargement, okay? With girls, let's see. Onset of puberty in girls, what happens with them first? And that's the breast buds, very good. Jennifer's on fire, here we go. The source of injury, whether intentional or unintentional in adolescence, is associated with what? Well, just think of injury in any age of children. And we always know that's motor vehicles. Injuries are always children. They're always going to have an injury due to many different things, but motor vehicles is the most. If a parent feels uncomfortable about talking about sex education, who would be that good resource?
Can I have the login again? I got kicked out.
Okay, go ahead. Or you can just listen, whatever you'd like. So school nurse is a great resource, or that Planned Parenthood, because just like my parents, they're so uncomfortable, and my mother just ignored it with me. So got to do what you got to do to understand it as an adolescent. It's a good resource. A 9-year-old's friend tells him soccer is a dumb game and he should play baseball. Is that a normal thing that happens with school-age children? Well, we know same-sex peers is the most important people in their life, so peer acceptance is important. And many children will change their game that they like just to be with their peers. Not uncommon. And Jennifer went up top. During admission, the father of a 16-year-old says, we're a Buddhist. Culturally competent care includes what? So the parent, ask the child. You will be so respected if you ask the parent or child if they have any sort of things that they need. It could be a diet, or it could be that their daughter they don't want a male nurse taking care of them. There's all different things. And, we don't know all the cultures, and we should never assume. What do? We just ask. When teaching sex education and contraceptive for adolescents, what should the nurse consider? And what they need is education, but they need it. You talk to them without your opinion, and you need it in the written form for them, okay? You do not need permission from the parents to talk about it. If they're asking you, you can respond, but only information, and you should also give them a written information of some form. I'll multi-select. The management of adolescent obesity should include So when you're working with an adolescent who's obese, number one, we need to find out, what are you eating on a daily basis? And then as a reward, we do give them a favorite food into their diet. They don't want to hear about something that's good to eat as a reward. No, if I want ice cream every Sunday, give me some ice cream every Sunday. It'll make a diet that they're more willing to stick to. Infants go through predictable sequence of growth and development. This is called, I'll go back and give you some concepts from previous lectures, only because they are important, and to reinforce and to make sure you understand these different directional trends, developmental pace, sequential trends, and sensitive periods. And it's easy because it says sequence of growth and development. It's sequential trends, okay? It's predictable what's coming next. They lift their head, they turn over, they get on their knees. This is predictable, sequential trends of growth and development. Which of the following drugs is the most common drug of abuse in the adolescent population? And it's alcohol. And the easy thing is because it's usually ready available. I mean, many parents have, bottles of alcohol, and they'll take it and they'll pour it into a water bottle, and they'll take water and put it into the alcohol and go on their way, and they've gotten what they want. Which benchmark serves as the ending period for the school age children? What is the ending of school age children? What do you see at the end? So we know that school age children, at the end, what we're going to see is the onset of puberty. We're also going to see all of their permanent teeth are in too, but it's the onset of puberty is the answer there. Michi's up top. An example of indirect bullying would be if what? We know children, they are bulliers and for many different reasons, but this is when they start using social media. So it's not directly at them, but it's through the social media environment. And they can be really mean. And the thing with, this indirect bullying, there are incidences that this bullying really affected them so well that they committed suicide, got in such a depression with it. So bullying is a big deal in children. Which action would improve dental health in the school-age child? It's as simple as flossing their teeth. Of course, brushing in the morning and night, we're lucky if they do that, but flossing can also help it because we need good teeth. You have them for life. Generally, the earliest age at which puberty begins is, I'm not talking about precocious puberty, which is really early, normal. And it's 10 in girls and 12 in boys. Because remember, at that age, you're in 5th, 6th grade as a girl, and we think boys are stupid then because they're not, going through puberty like, the girl is. I remember thinking boys were stupid back then. An 8-year-old girl says she has cancer because God is punishing her for being bad. Is that a normal way to think for a school-age child? And remember, these children do believe God is punishing them. And as nurses, if we let them know that, what you've done, you're not being punished, that, things happen because this is a belief. Just like when you get cut, all your blood comes out, your guts come out, that you're going to die. It's something to tell the child, no, you're not being punished. And Jennifer went up top. A 5-year-old needs to get a chest x-ray. What explanation is the best? 5, 6, 7-year-old, they need a chest x-ray. There's big machines coming after them. So just say that they're taking a picture. I'm going to look at your insides, and that's really cool. And I'm going to show you the picture. And it works. These kids love looking at their insides. How do you get an adolescent to open up about their sexual history? So again, start somewhere else, break the ice, and then ask about sexual history. Don't come out and just start asking about sex because they're going to look at you like, I don't trust you yet. How can you get an adolescent to be more receptive to talking about health and sexual exploration? So again, parents leave the room, they'll be more open. You've opened the door by talking about social events, etc. They're gone and they're going to talk to you a little bit better. A multi-select. When educating adolescents about the risk for HIV and hepatitis, what would you include? I remember sitting down with my son and talking about this, and I tried to scare the crap out of him. Did it work? Well, no, but thank goodness he's okay today. Of course, we always want to say abstinence with the adolescents, but you know, they're going to do what they want to do. But condoms, hand washing, these are all good things that can help. And the other thing about sex and girls is to have them urinate as soon as possible after having sex. And that helps with things like urinary tract infections. A child has a knocked out tooth. Where should the tooth be placed for transport to the dentist? And of course, that's in the cold milk. Good job. Keeps it ready, keeps it fresh, and they can implant it and it can work. A nurse caring for a school-age child should know which thought process is seen. What did I tell you about school-age children? And that's the ability to conserve. Remember the Little Debbie cakes. They're having the Little Debbie cakes will last all week long, or the uniforms will have enough to last all week long. And that's part of how to conserve. What stage of Erickson would you use for a school-age child? Think about school-age children. What do they like to do? School-age children love to be the best at things. They love praise from the peers and from parents and teachers. But they also feel horrible when they're not as good as somebody else. So it's industry, the task they do well, versus inferiority, which is the things that they can't do as well as they want to. They want to get praise from everything. That's what school-age children like to do. A multi-select. Anorexia nervosa is characterized by. Now, I didn't go over this in lecture, but there's two types of eating disorders. One is anorexia nervosa, and one is bulimia. Now, both of them cause the adolescent to be extremely thin. And anorexia nervosa is when you put absolutely no food in your mouth. It's like a piece of lettuce and some water. And they like over exercising because there's a fear of weight gain and they think they're fat and they're not. Vomiting and purging is the other side, bulimia. And what is bulimia? Bulimia is when you eat, and as you eat, you're vomiting, getting rid of it. So you have that taste that goes in your mouth, but immediately you got to get rid of it because you don't want to have those calories. Now, how would you know if an adolescent was anorexic or bulimic? Well, bulimics vomit. When they vomit, stomach acid comes up. So
They
their
have
teeth
corroded
rot.
teeth.
Yeah, their teeth rot. Absolutely. So that's how you would know the difference. Yes, very good. Jennifer's on fire now. How do you know if you suffer from bulimia? Binge eating and purging. Yes, very good. You listened well. Good job. The leading cause of death from unintentional injuries in children is, I think you know this one well. I don't think I need another question on it. Motor vehicles, absolutely. In it, driving it, or rolling under it and getting squashed. Adolescents are what? How do you describe them? And it's somewhere between childhood and adulthood. and they're so confused. They're looking for the identity. They don't know who they want. They're being frustrated by friends, by peers, by best friends. It's just a really troubling time. I never want to be an adolescent again. No, 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 no. What is an adolescent's heart rate? We know infants is 140 to 160. We learned that really easily, really quick. Adolescents? Well, adolescents are usually more active than the normal adult. So our heart rate is slightly lower, 55 to 90. Now, 120 in an adolescent would be too high. That child would have a fever or be dehydrated. So 120 is way too high. When talking with an adolescent regarding personal health concerns, which is most important? And yes, give them that opportunity. And you're going to hear things and they're going to try to shock you. And as a nurse, you have to not do that shock look. Say, okay, well, how did that make you feel? Or, come up with another thing, retort to that. But adolescents will talk as long as you've broken that ice, the way I said. Talk to them first and then start talking about things you need to know. A parent says infants put everything in their mouth. Based on Freud's theory, you would respond how? Infants, Freud. What do we know about infants and Freud? So everything is oral. Remember, sucking, chewing, swallowing, everything is in the mouth, and that explores their world, and that is Freud. Now, it's different than Piaget, which talks about touching, texture, mouth, and motion of things. So that's the difference between Freud, Piaget, and the early infant stages. In addition to injuries, a leading cause of death in adolescents ages 15 to 19 are? And it's homicide, suicide, and usually homicide is usually unintentional, that it happens, and suicide is from that intense loneliness that can occur. Cancer, no, it's the other two. In school age conflict of industry versus inferiority, what does industry mean? What did I tell you what that is? Being able to do something and then not doing as well as you should is the inferiority. So yes, mastering that task. Good job. At what age does intuitive thought start? Being able to put things together. Oh, we do this because of this, or oh, this is a circle, but that's the same circle, but it works different. Intuitive thinking more. And that is early childhood, between 5 and 7 years old. What age group prefers to be with members of their own sex? Same-sex peers. And that's your late school age children, which is your 9 to 11-year-old. 5 to 8, there's still not as much. It gets to be that older one that absolutely same-sex peers. What age group would have a tendency towards eating disorders? Has everything to do with body image. Body image, adolescence is one of the big things. How do they feel that their body is? Image. Lamika's on fire. True or false? Home support is invaluable to the adolescents. Do they still need mom and dad? And yes, they do. And the reason is, what if something happens out and, with friends and this and that? They still have to go home, right? So who's going to be there to support when they're feeling sad? You're going to have your parents there. So there's still need. They don't want it most of the time, but home support is very important. Contraindication to administering the varicella vaccine to an adolescent. Well, what is a varicella vaccine? It's chickenpox, right? Live vaccine. Doesn't matter, adult, child. When don't you give it? What question's so important here? Live vaccine has to do with immunosuppression. What makes you immunosuppressed? Corticosteroids. I've seen questions like this come off NCLEX and HESI, thinking about, that which vaccine can you give or not. So that's why I bring this up here for you. To improve adolescent health, adults must increase health-enhancing behaviors like what? Adolescents need to do what? To be better, to be healthier. And of course, it's good food. They need to exercise, they need to sleep, and they don't do any of those things because they're so busy with social and school and body image, etc. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? Which one of these is not anorexia nervosa? And that's teeth. Remember, teeth is bulimia. When you think anorexia nervosa, think of hypothyroidism. What are some symptoms of that? Dry skin, intolerance to cold, constipation. You've seen that before. Think about that. Decay in teeth, totally bulimic because they're vomiting. This is stomach acid. The risk of depression in transgender children is what? Absolutely increased because, again, this is the identity. They don't know themselves, people accepting them, etc. A 14-year-old in the emergency room after a biking accident, how should the nurse interact with this adolescent? Think about this, child comes into the emergency room, backboard, neck brace, tape down. Everybody's going after cutting clothes, x-rays here, doctors, going crazy, taking care of the kid. And usually the child gets there before the parents, okay? So when you are there with a child as a nurse, you're their advocate. So telling them, okay, my name is Betty, I'm the nurse, a lot of things happening quick, we're going to do this, this, and that. Any questions, answer the questions, make that child feel comfortable, and make them not go through a horrible experience because it can be scary even to a 14-year-old, to an adolescent. Cooperative play, what's that? So cooperative play is when two children or more work together for a common goal. Like, this is how you win the game. Or we want to build a castle and you build the castle. It's working towards a goal. You can play together, associative. and do different things. But cooperative is when that common goal is done. You do the castle, you win the board game, etc. What does moral development involve? Another Kohlberg question. So remember, moral, Kohlberg talks about right and wrong and consequences of them. Good. I think you understand that now. Developmental milestones are important to observe because what? Why do I need to know when they lift their head, turn over, walk, crawl? Why do I have to know this stuff? Because when we know that they are held behind, they're not doing what they're supposed to do, we can institute early intervention and maybe get that child caught up to be the best they can be. Very good. Lymph nodes in children with normal findings should look like what? Healthy child, normal. What would you see? Absolutely nothing. You don't feel anything. They're not there. Only when they're sick do they swell and you'll see them. The right second intercostal space landmark of the heart is called. Now, general assessments, are done, and we will be listening to heart sounds on many children. So the right second intercostal is your aortic valve. So understanding where to put your stethoscope to listen to a child is an important thing that you need to know. It's part of the assessment. Which nerve controls critical movements of the tongue? And you see a baby can do it. They can stick their tongue out, can't they? And that's the glossopharyngeal or the cranial nerve number 9. What type of breath sounds do you hear over the trachea? We've discussed this. It was part of the PowerPoint. It's up here, the top part, trachea. It's not down, into the lungs yet. So what are you listening to? Children have these big adenoids and tonsils, and it holds all of their secretions there. So these are bronchial breath sounds, okay? When you want to listen to real breath sounds, actually, you can listen to the lobes of the lung. Depriving a child of food, clothing, and shelter is called what? That's a definition for what? And that is called neglect. That's an absolute definition of it. And Michi, Mika. Which of the following immunizations is given in the adolescent stage? And that's your HPV, absolutely. Good. Preventing cervical cancer. ADHD most likely involves which of the following? And that's inattention, impulsivity, hyperactivity, unable to complete one task before moving to the next, being disruptive. Good job. Adolescents typically place blank on peer relationships. Your last question. And absolutely high value. They really need to be respected and part of a peer group. It's a high value on peer relationships. All right, let's see how we did. Number 3. Michi. Good job, Michi. Whoop, whoop. Number 2, Ari. Good job, Ari. Number 1, Jennifer. Good job, guys. Number 4, Lamika and Jessica. Good job. What I want you to do is sign your attendance attestations so we don't forget them, okay? Any questions for me at all about anything? Tired? Had enough? Mind fog? Have a great night.
So
Go ahead.
Professor, besides the PowerPoint for the review for the exam, you said to also look at the Kahoots as well. It's helpful.
I would review them. They have concepts that you need to be able to apply in different questions. Yes.
Okay.
Thank you, everybody. Have a great
Thank you.
night.
Good night.
Thank you, you too.
Thank you
Good
so
night.
much, guys.
Good night. Thank you.